Hello, everyone. Good morning, good afternoon, good evening, wherever you are on planet Earth. Welcome to our first episode for 2026. This is Conversations in Planetary Health, a monthly conversation tackling various issues at the nexus of human health and the planet's health. I'm Dr. Renzo Guinto, Associate Professor and lead of the Planetary Health Program here at the Sing Health Duke-NUS Global Health Institute, Duke-NUS Medical School, National University of Singapore. Again, welcome and Happy New Year. Today, we are going to have for sure another interesting, inspiring, informative conversation, similar to the conversations that we had last year. And we are very fortunate to have with us a colleague and a friend who is visiting town here in Singapore. He is the head of the Meta Research and Evidence Synthesis Unit at the George Institute for Global Health, based in Sydney, Australia. He is also a conjoint senior lecturer at the UNSW, also in Sydney, originally from India, and he's doing a lot of different projects in global health, in health systems, and in climate and health. And just to remind our audience, we are recording this session so that those who couldn't join us live can also access the information, the knowledge, and the wisdom that will arise from this convening. And of course, after a presentation from our guest, we will then open the floor, the virtual floor and the physical floor, for questions, both from the audience here in Singapore, but also those of you joining us online. So without further ado, let's give a warm welcome to Dr. Soumyadeep Bhaumik. Soumyadeep, welcome to Duke-NUS.
Thank you, Renzo. Thank you for inviting me, and thank you to all of you for hosting me and this talk. I'm very glad to start off the conversations in planetary health for this year. So I'll be talking a bit about the dimensions of justice for setting priorities on climate change and health research. But before I do that, I will declare my conflict of interest. I do have an ideological conflict of interest as an advocate of equity and justice in the health knowledge ecosystem. So please take all my work into that account. So that quite influences how I think about things. So please take that into account when you look at the work. I have no other conflict of interest to declare. So we know that climate change is the greatest threat to global health. And I mean, the inevitability of justice in climate change and health is quite evident. Like, we do have disproportionate impacts in low and middle income countries, in marginalized communities within countries, but also on nature and other species. Like, our actions are impacting them more disproportionately, perhaps, than us, and also on the future generations of things. So this is quite well known and well understood, and I believe because this is the conversations in planetary health, I really don't need to advocate for this case. But I think the larger element of it is that climate change is not just a health crisis, it is a crisis of justice, because the justice issue that arises from climate change cuts across not only in health, but also livelihoods, housing and the built environment, the food systems we have and the food insecurity challenges around it, the labor and working conditions that will arise as a result of the complex changes that will happen. And it cuts across very multidimensionally based on gender, class, and caste. And what we are also seeing very recently is the colonial domination and the contemporary techno-feudalism, how that is affecting climate change, is not only acting as a driver, it's kind of a vicious cycle, especially with the climate impacts of AI. And I think overall, we do see that all of this is actually a crisis in justice. And if climate change is a justice crisis, then we cannot be setting priorities for research on climate change and health in a justice blind manner. And I've used the law framing about the Lady of Justice being blindfolded because it apparently helps them to deliver justice without consideration of caste, gender, or other domains of health. But it's now time to unfold that blindfold and actually do things in a more pro justice manner. And this is the premise of all the work I will be talking about today, and the work we have been doing with my really fabulous team in the institute. Uh, and and I believe that this is something we need to be start thinking about, considering what is the lived realities we are living in our own lives, and what we are seeing in the news cycle every day. It might look distant to us if we are living in different countries, but the a crisis of justice and the breakdown of the rule of law, which is essentially procedural justice, and we'll be talking about the other forms of justice too, is actually a very strong area of concern which will affect our lives, and probably not so far in the distant future. So before I go to talk more about justice, I will talk a bit about research priority setting, because I think our element is around how can we set priorities in a more pro-just manner for climate change and health. So a research priority setting, if we look at very broadly, is a stakeholder or interest holder driven process, which comes out about decisions on recommendations about what health research questions or maybe sometimes areas of research should be prioritized. And just to add, I use the term interest holder because the term stakeholder originates from the practice of putting a stake in indigenous land and laying claim to land which was never ceded legally. So it's a more culturally inclusive term, and but it essentially means the same as what is conventionally like more dominantly referred to as the interest holder, as stakeholder. So this process has various types around it and a lot of elements around it. And broadly, if you look at it broadly, this would have three very broad phases of priority setting. People prepare, then they prioritize, and then once they prioritize and things, they follow up, learn from the cycle, maybe go back and this. These are the very broad phases of research priority setting. But if you look at it, there are a lot of methods, and again, this is a brief snapshot of things. So expert driven methods, burden driven methods, then there are structured scoring driven methods, then multiple explicit criteria driven methods, then there are also national needs and stakeholder engagement related uh, methods. And as for example, Philippines is a country which actually has a legal mandate to do research priority setting at various levels. So probably one of the world's only. So there are quite a lot of these methods available there. All of them very technically sound. And of course, if there are different methods, there are pros and cons of each method around it. But they have one commonality, and that commonality is they try to answer what research questions should be prioritized, or what research areas should be prioritized. So the focus is on what. Okay. And overall, they're quite a if you look at broadly of this approach, the hits of these approaches are they consider a lot of factors. They also consider feasibility, which is actually quite good in the sense of it, and many of them are on expert consensus driven, but they miss on power, historical responsibilities, and structural injustice issues. So, and this is across the spectrum of things, and this is because of how we as scientists think is valuable in the knowledge ecosystem. And let's face it, we are thinking about what research can be funded. So that's why we are interested in what are the priority questions, and we take inputs from all the interest holders to know, okay, this should be funded. And while I do talk about hits, this is like the marketing campaigns we see $13 with a small conditions apply. The hits are not always a hit. So that's the reality of the world we live in. It will be a hit only if there are a lot of elements that is there. So the WHO quite prominently recognizes this issue. And last year, I was one of the writing committee members of this guidance. So last year, the WHO came out with a guidance on the ethics of research priority setting, which the main focus of which is that we cannot be implicit or not explicitly say what are the ethical values or considerations we have done in the research practice setting. What we do is we do make it, but we never recognize them probably consciously, or even if we recognize it consciously, we do not state it exactly like this is our value standing, which we do that. And this is true for all the methods broadly which we talk about. And this is a very practical application based priority setting guideline. And again, there's not a lot of empirical work in this domain. So we have, I think this guideline kind of is the first phase of it, which will improve as more and more work is done. And that's why it's also accompanied by a case book, which has 10 cases under this various scenarios of things, which really gives you the nuance of it. So it's a very good book to reflect on the applications of things and realizing that this is not like the clinical practice guidelines where you are told, please do this, and you are well to do. So it's quite a learning guidance in that way. And I told you about this key messages already, but I think one of the more important messages is that there's no one size fits all methods. It has to be adapted to the scenario of things. But there are four key values which this guideline recognizes. One is on optimizing social value, which is what is valuable to the society, which is a bit contrast to what is of knowledge value, which is valuable to the academic community and the kind of stakeholders we engage with. Uh, we also be supportive of special obligations, which uh, whoever is commissioning the research priority setting, or if we are doing it on our own, what we might have. But we are talking about ethical obligations to specific populations or patient groups, not to shareholders. Just to clarify, if a pharma company is doing that, of course, it has to assess risks, the risk harm things, but not just on animals, but also on non-human animals and harms to human third parties, essentially future generations around it. And of course, it has to follow fair processes. So the procedures should be transparent, accountable, and inclusive. So these are the four key ethical principles that guide research priority setting as of now. But where does justice stand in all of this? And if I may now try to bring the two pieces we are talking about, one is about setting priorities for research and climate change, and second is about what is justice per se, and how both can be integrated. We have to talk and know what justice is. Okay? And we all know what justice is. I think if I may say, like even a child who is born and once it starts getting conscious, like 2 or 3 years old, they know when it feels wrong. Okay, okay, and justice is very cross cultural. Okay, Nobody needs to be taught what justice is. People have an implicit understanding of it, which is a bit different from equity, which people needs to be taught about and discussed, and the misgivings around it needs to be specially stated around it. But so justice broadly is uh, so justice broadly refers to the moral concept that each person, or it might be an entity, individual, or organization, is entitled to get what is their due. So it's very broad. We know what it means, but to operationalize this into what we do, this definition is not enough, because this is very normative, this is very broad, very conceptual. Uh, so we need to understand what are the dimensions of justice. And that's what we will do it together. And what we will do is we will do what I call is a bit of weaving. So unlike in Western epistemologies where there's a lot of focus on uh, building new concepts, inventive framing, I prefer weaving, which is building on existing concepts and bringing them together, because it allows pluralities of knowledge ecosystem to survive, and it also allows people to integrate and engage more with what they already know and understand. It's not something new and they have to try to weave around and understand a new thing. So we bring different concepts together and then try to see what that means for research priority setting per se. So my first concept is procedural justice. We know what it is. That's the legal systems are totally based on procedural justice, which is everybody has to get to go in the same process. The process is well defined, it's transparent, and in the process there are accountabilities fixed of who is responsible for what. Okay. So that's procedural justice. We understand that quite well. Then is restorative justice. So that's the also comes from the legal systems, but which is that if somebody has been harmed, something has to be done to restore it. Okay, as for example, the like sometimes courts award compensations to people who have been victimized. So that's restorative justice. Either to give an example, like in India, the government gives any person who dies of snake bite is given an ex gratia amount to their next of the kin, acknowledging that it's the government duty to work on this domain, but somehow that didn't happen. So I'm restoring some amount of it by giving a financial compensation. We can go into the argument about what the amount is, whether that should be invested into it, but conceptually, that's what restorative justice is. So these two are very well understood, very embedded in the society. But then is also the concept of epistemic justice. This is quite an academic things, but I think this is something every human being engages with on a daily basis. So epistemic justice, the blue one, has actually two elements. One is testimonial justice and other is hermeneutical justice. I mean, the terms look a bit heavy, but it's very easy. Testimonial justice is someone's opinions or value or thoughts are considered less valuable than the others only because they belong to a certain class, caste, gender, color, or things like that. As for example, if I'm from a dominant community and I go to the police and say, this person stole something from me, the police will immediately take an action. Whereas if you are from minority community, the police will ask me 10 questions and then go to take action. They will still take actions, but I have to convince them more to do that. So that's testimonial justice. Hermeneutical justice is a bit more layered, where both the parties or multiple parties involved do not have the common conceptual understanding or the language to communicate to each other, because of which they don't value what each others are saying. Example from this, and this is not my example, this has been stated quite a lot, is when women were initially starting to work in the Western industrialized society, there was no concept, nobody had coined a term of sexual harassment in workplace. So it was thought as something you have to deal with. So people felt bad, but nobody came around saying that I was harassed, because it was not seen as an harassment. It was essentially people lacking that concept. Once that term was coined by a sociologist, people started recognizing it. And very recent in the last decade, as the understanding of the concept has gone, we have seen what the Me Too movement has done. So that's hermeneutical justice in practice. So, and that happens quite a lot in the work we do as holders of knowledge. So both testimonial justice and hermeneutical justice comes from the epistemic justice. There are two types of it, and it is wrongs we do because of the power we have as knowledge holders or knowledge creators or knowledge disseminators. So that's epistemic justice. And distributive justice is, it has to be distributed equally among people. So if I have $100, it has to be distributed to people either equally or based on what their needs are. Again, that's a separate discussion, but that's the concept of distributive justice in itself. And of course, intergenerational justice, that we cannot think of just the present, we have to think of the future. And I would like to include within the concept of intergenerational justice, the justice to the other species too. So that's the all the elements I can think of. If there are other more, please bring them up in the discussion. And that's the power of weaving. We build on the other concepts and try to merge them together. So if we look at these concepts into the research priority setting space, so we have to have all of these to have just and fair research priority setting outputs, in the hope that these outputs in the long run, along with other ecosystem initiatives that happen, will create a pro-justice knowledge ecosystem. So this is not something that will fix and makes knowledge ecosystem alone. This is one of the initiatives, and we have to do a lot of other things to do that. But this is an essential initiative we have to do. And the way to integrate this is, when we talk about what research questions, there's a lot of focus on procedural justice in all the methods. They try to be transparent and do that. So reporting, governance, all that is quite being done well. What is not there in the existing methods is the dissemination, evaluation, and update. That's not quite good. They exist, but of course that can be strengthened. So the accountability part needs to be strengthened. But broadly, procedural justice and its elements in research priority setting is well recognized. Okay, so that's quite there. The other elements, on the other hand, are quite a bit challenged, and we need to think about them. And in terms of hermeneutical justice, which is lacking concepts, we need to be integrative of different systems of knowledge. Indigenous health, as for example, and also a lot of Eastern epistemologies recognize the health of humans, animals, plants, and nature as one entity, and did not try to optimize on things. And I'm sure all of you have seen the planetary health boundaries, like, oh, this is crossing them. And if you look at it, it's a very philosophically, it's a very optimization principles. We will exploit up to a certain level and then stop. That's what we are trying to do when we are talking about planetary health boundaries. But that's not what Eastern and indigenous concepts of interaction with health are. They see health as one entity, and we will protect health as much as we can, okay, and use only what is required. We don't have to optimize it. We'll only use what is required. And that's the philosophical differences which is guiding the knowledge frameworks we use around these domains. Okay. So we need to be understanding of this, and we need to be bridging gaps in understanding. And I was telling you about these methods. They have these criterias, like some of them use criteria. So they would have criteria. Is it feasible? What is the cost effectiveness? Things like that. Does it mean anything to interest holders from the community? Can they actually rate whether it's cost effective or not? These things, these concepts, when we bring in, people do put in ratings, but in essence, they are hermeneutical injustice which we are doing in our knowledge, which we hold, they don't understand so much. Okay. So the use of substantive criteria for setting research priorities does bring in an element of hermeneutical injustice. That doesn't mean that we stop doing it. I'm not advocating that, but it means we need to be thinking about it. Also, we need to be share capacities with them into what these things mean. So these bridging gaps in understanding is there. Same about testimonial justice. So who is managing, who is leading this work? Okay. Who is eligible to participate? Or more importantly, I have not written it there, but what I mean to say by eligible to participate is who is excluded by the process. So, and also who is given credibility in the discussions in the consensus meeting. And you will note that I said expert consultations is one of the methods, which means me, because I've done a PhD, I'm considered an expert. Okay. I might have never lived in the climate change and health domain. Just, whereas someone who is living it on a day-to-day basis and have experiential knowledge of what climate change and health means is not considered an expert. So that's also an accordance of credibility. So these elements needs to be thought about. So, and you see what I'm doing here is, apart from trying to answer what is the research priority setting, I'm trying to interpret who is this for and how is this who is involved in the process and in what manner. Okay. And of course, this who also links to this restorative justice and distributive justice and intergenerational justice. So all these elements interact with each other. And again, these elements are not uh, really separate. Okay. They all work together as a tight-knit group to work on these domains. And in this part, it will lead to just and fair RPS outputs. Okay, so I'll just very briefly go to a systematic review with it using this broader conceptual work. And this work was led by Sushan. She is one of my students, and she led the work. I'm just presenting this. But quite a big team in the George Institute, funded by the World Health Organization's ethics unit. So we included all research priority setting on climate change and health or extreme weather events, and we took a bit of a broader understanding of things, and it can be any frameworks they have used, the traditional concept of human health, or even broader, like planetary health, Pan health, or eco health. So included 19 studies, 17 research priority settings, and just give you a snapshot of what are the different types. Some were global, some were regional, some were broad and non-specific, some specific disease-based, and yeah, just giving a snapshot of what these research priority settings look like. Okay. But in terms of the procedural justice, so just to add, so in 2020, we worked on developing a reporting checklist called REPRISE for reporting different steps of a research priority setting, and essentially have to, it's a transparency thing, like what are the elements one should report in a research crisis setting? None of these 13 exercises which were published after 2020, we weren't expected from the ones which were before 2020, it was not there. None of them actually used that. Okay. And they were not actually reporting on a lot of elements which is required in terms of transparency. Many of them didn't use a structured framework, which makes it very difficult to know who is accountable, who is transparent, what methods were used. And 70.6% never assessed whether research questions were already answered or didn't take into account the existing knowledge to do that. And so these are quite a bit of procedural justice issues, but in terms of epistemic justice issues, we looked at various dimensions of marginalization or discrimination, whatever we did like to call it. And we ran through the research priority setting exercise to see how many of them actually considered different types of groups. So out of the 17, you see 15 included researchers, health professionals, sometimes government, NGOs, research funders, some policymakers. But as you go down the ladder, you see like real people for whom we are doing. Patients, vulnerable, marginalized group. Just one or two of them did that. So that's where testimonial justice is there. In order to also understand a bit of nuance, we kind of adapted this engagement model to try to understand. And this is well developed. We just adapted it for research participating, categorize whether they were just informed, they were participating, they were collaborating or leading the process. And this is what we found. I think the slide is quite self-explanatory. You can see indigenous people, low and middle income country people, and we did it only on the global ones. The healthcare workers, industry, very important stakeholder, as well as funders and members of the public were largely not involved. Okay. And only in a few of them, like they did really good by actually having them involved in it. But it's quite a minority, and many of them were also not clear on this. So it's a bit of a challenge around how it is done. And in terms of epistemic injustice, all of them were blind to indigenous knowledge or traditional systems of knowledge. Two did provide some capacity sharing with, or capacity building as they called it, with the participants, so that there was a bit of engagement, but we need to do more of this. And another very interesting thing is about what is the relationship between scope authors and funders. You can see that largely the global ones were done by HIC countries, and even in the national, subnational ones, of course, they did receive quite a bit of funding around it. So all the global ones are led by high income country actors and also funded by them. So it's quite a challenging space we are in. Very quickly around intergeneration aspects being conserved or frameworks of interconnectedness used, or whether it focused on health of humans or polluter fees principles, intergenerational aspects, like quite concerning across the spectrum, if I might say. And we did something in recognition that it's quite challenging to integrate justice. So I might not have done all of it, but was I doing discussing them? So we kind of tried to read through the discussions and do that and see if these specific aspects were captured. There was one which actually did quite a bit, the green one, SETI 2019. All of them neither considered, or some did a bit of moderate, so the traffic light system. So in terms of the work, coming to the end of my talk, of course, there's quite a lot of work needs to be done. But what is largely of importance, if I might take the broader picture is it's no longer enough to talk about what research questions should be prioritized. We have to talk about whom are we prioritizing for, who will be the users of this knowledge, why, what, and how. Okay. And we need to be using research priority setting not as a tool for technically figuring out what questions on climate change and health should be done, but as a pro-justice tool to not only affect the knowledge ecosystem, but also the lives of the people whom we want to work for and whom we work for in nature. So that's all. Thank you and happy to take questions. And yeah, if you want to email me later, feel free to.
Thank you.
Over to you, Renzo.
Thank you so much, Soumyadeep. Maybe let's give him a big hand. And to those online, they're giving you a virtual clap as well. Thanks for sharing with us, the 5 dimensions of justice and how, these can be applied to research, priority setting for climate and health in particular. And I was reflecting, oh, this can actually be applied not only to climate and health research, but to other arenas of health research, or even development research, environmental research, but also it can also be applied to various levels of action in the climate and health space, from formulating the research question, right? And this is at the level of the researchers themselves, all the way to identifying what sort of climate and health solutions to implement. So even beyond research and research priority setting, the actual implementation and deployment and delivery of solutions, I think your dimensions can very much be applicable as well, and even for climate action in general. So there's so many levels and dimensions. Certainly all of these are interconnected. Of course, I invite our online participants to please share your questions and thoughts in the chat box. I will read some of them. We also have advanced questions asked by our participants when they registered via Zoom. And of course, we might have 1 or 2 questions from the room, but I am really struck, and I agree and appreciate your use of the phrase interest holders. Right? I think that's one key learning that we're getting from this presentation. And maybe one question in relation to that, that concept is, how do we really, in a justice-oriented way, engage, involve, you know, incorporate, and maybe that's even the question, what is the right verb that is justice-oriented, right? Is it enough to involve them, or should they be even co-creators of the research of one specific interest holder, and perhaps the most important of the interest holders, which are people in the front lines, directly already affected by climate change and the health impacts. So the question is how, and what's the verb, and how do we make sure they're engaged, involved in research, priority setting in general, but also in the conduct of research, but also in the process they're not being harmed because they're already suffering from the impacts. Any thoughts?
So, I mean, I can come up with a lofty idea saying that they should be the one leading it, but I don't see it as a practical way of doing things. So, and that's the reason why we actually kind of adapted this spectrum from the community engagement and research model. So I think there's a bit of understanding that research priority setting exercise is also a learning process. Okay? And people like me who do research priority setting sometimes advise or do it technically. I think we need to be more humble in our approaches. And we need to be taking into account time, knowledge, and resources needed. And our methods we use and the type of engagement we do should be in proportionate to what we have. And we should be acknowledging that okay, in this research priority setting, we only consulted, we couldn't involve, collaborate, or get them to lead because we didn't have the money to do it. Okay. or we didn't have the time to do it, or maybe I didn't have the capacity to know how to engage with indigenous people in a meaningful manner. We should be saying this upfront instead of coming up and saying, here are the top 10 research priority questions for you to fund. Okay. And these these exercises in humility, I think, will really help in the interest holders to actually understand what they are seeing and use it in a more judicious manner. Yeah. And there's quite a lot of work, and my hope is over time, as people keep on doing research participatory exercise, and there's a cycle, they will start moving more towards the spectrum of leading or support, where maybe researchers are actually very just attending meetings to inform it. And that's how ideally it should be. And we need to be engaged more in the democratic processes of the society and the community processes there. So there's quite a lot of work for me as a methodologist on the how part of it. I don't think I think that's a journey the community of researchers and along with the people involved has to take.
Following this line of thinking, of interest holders, we talk about the people in the front lines. On the other hand, we researchers, you describe yourself as a methodologist. We researchers are also interest holders, and earlier we also made a comment on the term expert, right? Who's the climate and health expert? I always say we cannot be armchair planetary health researchers where we just play with the data, come up with a paper, and then that's it. We actually need to, be with those who are impacted. But also you're acknowledging that there may be resource constraints, there may be physical, geographical constraints. So what else can we do as researchers? I even hesitate to call ourselves experts. Maybe at the end of the day, there's no one can claim expertise on a very wicked problem and complex problem. How can we be better scientists and researchers? You also mentioned a while ago, we need to be humble. So maybe practical tips, especially to those researchers listening in the room and in Zoom.
Okay. I will start with a disclaimer. I quite struggle with this on my own. We all live in systems where we have to work with the systems that are there. There are structural challenges which we recognize, and the structural challenges are probably becoming worse with the politico-socio-economic scenarios we are seeing not only globally but also in many national and subnational settings. I think as a researcher at any level, at any capacity, it's very important to engage with the concept of epistemic justice, which Miranda Ficker first coined the term and actually helped us understand. And our methods needs to evolve to more pro-justice methods. And apart from humility, we really need to be actually know what our expertise areas are, focus on those areas, but then also acknowledge their limitations and not try to use the same tool to address every problem. Okay, so and I think those aspects are needs to be built on. So that's one element. But I think recognizing epistemic injustice as a concept helps us understand that we can actually do harms as knowledge creators, knowledge disseminators, or knowledge viewers, as I did. Okay. And of course, there's no perfect way to do it because it's a complex. We learn on the go. But if you are reflective and are transparent about it, it will really help us to get those elements sorted in the way. The third element is we do quite a bit of engagement with funders and government in the work of our research. And I think it's prominently increasing now in the space researchers are working on. It's the traditional researcher who sits in a room and is lost, is gradually getting replaced. And I think sometimes we need to be a bit more bold by telling them that, look, I know you have this much money and this is what I can do. But when you do this, this is the weaknesses we are building in.
Yeah.
And sometimes also say that, look, I do this part, but maybe you should bring in this person or get this other person to lead. I know it's a very difficult scenario to do in the structural ambiguities we live in, but I think building more collaborations is there. And the last point is that we need to be stop thinking that we are objective in our research. Everybody has values.
Right.
People might disagree with our values. Let's be more explicit about it and saying that this is where I come from. This is the underlying value system which is driving it. To give you an example, like when we talk about research on planetary health, there's a lot of research on healthier diet, free from meat and other things. It comes from a very culturally blind perspective, as I see it. Okay, like people don't make food choices on a rational basis. It's tied to identities of people. Okay, and fine, we know it's true that it brings down the carbon footprint. Not contesting that, but what does it mean to food choices of different peoples? It might be their identity. We cannot be focused on a metric of carbon footprint alone. We need to see what it means in terms of the person who is going to follow my recommendation. And if I make like bring in Amar Hussain, who is a pro-justice thing and gave us the capabilities approach, he clearly says that his work clearly shows that people should have the freedom, and he brings in the concept of freedom as justice, that people should have the freedom to do and be what they think they value in systems. So I think we need to be more multidimensional and creative instead of being focused on, okay, everybody is wanting carbon footprints. Let's measure that and do that.
With your comment on the planetary health diet, maybe we should establish a global South-led planetary health diet commission. Of course, hello to our friends from the Lancet Planetary Health Diet Commission. And thanks for all the tips that you've given. Of course, and you acknowledge this, easier said than done. But that's why it's important for us, scholars, researchers, practitioners to be having this collective reflection together, right? Exchanging good practices, but also sharing our struggles. And maybe through this constant conversation, we'll be able to find, ways and solutions for the way forward. Let's have a question from the room. And then after that, wow, our chat box is exploding. So I will ask several questions as well. Please, quickly your name and affiliation.
Hi, everyone. My name is Dr. Gurpreet. I'm a consultant with UNU IIGH and a visiting scholar at SOAS University of London. Thank you, Dr. Bhaumik, for picking out so many important issues that we are kind of grappling with. I am very firmly a decolonial researcher. And I would like to go back to the strand that we've been talking about, who to include, who should be leading the why, what, how. My issue is, as a researcher myself, as a Global South woman, as a South Asian woman, who very firmly experiences testimonial and hermeneutic injustice in the health space, in the climate space, in the academic space. I find that a lot of these words, collaboration, co-creation, co-production, have become buzzwords.
Correct.
And a lot of the research that is being, put out, whether that is on, research ethics, research principles, every policy recommendation says co-create, collaborate, co-produce. My question very firmly is, it is not just who is involved, but how does co-creation, co-production, co-leading materially benefit the people you are saying should co-create, co-produce, co-lead? Because as long as we are still stuck in these buzzwords, we are only replicating a very colonial and extractive form of research. It never goes beyond that, which then reflects on the researchers, where structurally then, if we put forth a very novel decolonial framework, Lancet will not accept it. Any other journal will not accept it. They throw it back and say, oh, you have not followed this research method. There is no cogent method. So it becomes a catch-22 situation where we are putting out all of this, but as researchers we are also facing the struggle when we want to detangle a lot of these things and very firmly put forth steps. We are not able to as well. So any thoughts on this?
Thank you. It's a great question. I will try to do it very fast in the interest of time. I think a big challenge of this I think a big challenge of this question and how we address is the fact that we operate in a structure wherever countries we are based on, which does not benefit the system, and the metrics we are chasing as researchers are publications in journals. Okay, so we need. I think the way to do it is actually not worry so much about it, and actually create those institutional spaces where the other kinds of impacts are recognized in the pathways of how it can be done. And I don't want to sound overtly optimistic, but I believe if we are doing good things and persist on it, over time, those institutional spaces can be created. But more practically, I think we have to also trust and understand the problem is when these things were developed, they were developed to address exactly the problems we are doing. But then we algorithmized it. Okay. So, and operation, and when there's a when a funder says, I will only fund if it's co-created or co-designed, everybody writes, we are co-designing. And this is not a fit for approach. You have seed grants which what kids gives once co-design, and you cannot co-design in a seed grant. It needs resources. I cannot ask. It's my job. I get paid salary. I cannot ask a person who is not paid a salary to do this and has a job to co-design with me without putting in resources for do that. So the problem is these concepts are being implemented in a context and proportionality blind manner. So, and I think one of the reasons I actually like the ethics of research priority setting is it's I think it brings in the concept of proportionality, and we have to engage with funders and other people to build that in the work we do.
Yeah. Some of your answers actually touch on some of the comments from our online participants. Philin Salvador from the Philippines, she was actually asking, what do you think would be adequate compensation for interest holders' time, live experience, resources in their participation in the process, right? Usually we give them a small honorarium, and it's not just the time, but actually their whole experience and expertise. We are paid as consultants, right? And we are not treating our interest holders, in the same way. So something to think about as well. Min Garcia, also from the Philippines, from the Asia Foundation, she was saying pursuing justice work also requires challenging the notion that science is supreme or superior. She's giving a word of caution against extractive approach over indigenous knowledge, but without including them. I mean, I'm sure you've seen this trend, different universities establishing indigenous research offices or ethnic studies but actually who are still the ones, on in the driver's seat, right? And are they even included as well? One thought that crossed my mind, and this is might be extreme, and this is extreme, but also this might be a way of ourselves kicking ourselves out of our jobs. Maybe the current academic system is not compatible anymore with justice-oriented climate and health research work. So that's something we should be thinking about as well. Go ahead.
Let me quickly add. I mean, of course, my work is in climate and health. This is planetary health, but I will just say this is not a problem in climate and health research. It's across. I mean, we didn't do the research, but I broadly believe this is true across the health research
Yes.
space. I'm bringing to the point, uh, I really value the Australian system of how they govern the indigenous health space and the systems they have put in for there. I mean, I don't know about a lot of other countries. My work is mostly India and Australia. So, and they have actually put in place measures to prevent that extractive system. So, I think it might be good to look at and advocate for those types of systems. Obviously, not seeing a copy paste, contextually adapted, and also add in new concepts from your own context to do that. Yeah.
Wow, you know what? We only have 3 minutes remaining. It means we need perhaps a second episode or a longer, conversation workshop. We surely are just scratching the surface. I just read some really interesting questions. For example, one question: how can we even do our climate and health research in a climate-friendly manner, right? Because, and this is something we are guilty of, every day. We travel, we consume electricity when we use our laptops, and when we use AI for health research, for climate and health research. So are we adding insult to the injury, right? Are we conniving with the climate crime while we're also conducting climate and health research? So maybe that's another form of injustice. And we barely touched the funders, right? Now funders, one, very limited, some even pulling out. What happened to the States? A lot of climate and health research money being pulled out from researchers. But also some of our funders are looking for the silver bullets. There are a few funders. We want your project to have AI, for example, when, we know it is not the only solution, right, to our many interconnected problems. So wow, that's a lot. And well, thank you very much, Soumyadeep, for your time and for sharing your expertise with us. Of course, thanks to our online participants, but also to the ones here in the room. And I will just share a few slides to give some announcements. So if you want another conversations this week, so we're just starting the year. And as I've mentioned, it's a monthly series, but we have not just one, but 2 episodes this week. So on Wednesday, please join us in our conversation around integrating sustainability into a health organization's DNA. And we have with us Maha van Bruggen, who is from the Geneva Sustainability Center of the International Hospital Federation. So she's coming from Switzerland to here. She's in town for other activities, but she's very gracious enough to drop by Duke-NUS to have this conversation with us. So please register both in person and online. We also have next week the first ever Singapore Global Health Film Festival 2026. You're seeing the panelists. It's on the 27th and 28th of January. And on January 28th, day 2, we will have a film focused on planetary health. So please join us in this not only film showing, but also, I guess, a continuation of this unending conversations. And then we have, and in connection to ethics, we have an open call for case studies. We're looking for case studies that depict or portray the ethical challenges faced as healthcare organizations, hospitals, public health agencies try or attempt to realize and implement climate smart healthcare? Do we want to mitigate or adapt? Do we think of environmental sustainability first or our patients? So these are the kinds of case studies we're looking for. Please use the QR code. The deadline has been extended actually up to January 30. And if you're selected, we will bring you to Singapore for a workshop in April, which is Earth Month. And finally, we invite you also to enroll in our week-long planetary health module, Planetary Health from Analysis to Action. It will be held on April 13 to 17 of this year. Please visit our website for further information. So that's it. And again, Happy New Year. Thanks to everyone. See you in the next episode. And let's keep the conversations going. Take care.